Prior to removing or deaccessing a Huber needle, we need to place a mask on the patient and a mask on ourselves. As always, when you enter a patient's room, you want to knock, you want to introduce yourself, and you want to identify the patient with 2 identifiers. Prior to starting any procedure, you want to assess the patient's status, ensure that they're not in pain or they don't need anything prior to beginning. So to deaccess a Port-a-cath, typically we're going to apply clean gloves, and then we're going to get our saline flush and a heparin flush. We'll have our alcohol prep pads, and we'll have sterile gauze and tape to apply once we remove the catheter. To begin with, I'm going to open my alcohol prep, and I'm going to cleanse the outer side of the port. And once that's cleansed, I'm going to apply my normal saline, and I'm going to unclamp, and I'm going to flush and pull back just to check for patency, and then we're going to continue to flush with 10 mL of normal saline. We'll clamp that off during the last little bit for positive pressure, and then we'll remove that, and we're going to get a new clean alcohol swab and cleanse the port for 10 to 15 seconds to ensure that we have not contaminated. Now I want to get my heparin, and I want to open my cath and flush with the prescribed amount of heparin, which in our case is 2.5, and then I'll clamp that off. And now we are ready to remove our dressing. We will remove our dressing, and at this point we want to grasp each side of this port to ensure that we have that held down good and properly so that we can remove the Port-a-cath Huber needle. We're going to pull upward perpendicularly to the port and remove the Huber needle, ensuring that we place the lock stat in place, and then we will throw this away in the sharps container. We hold pressure with sterile gauze until the patient has reached homeostasis, and then we will apply clean dressing with tape and assess the patient's needs, ensure that everything is good. We'll document the procedure, and we are done with deaccessing a Port-a-cath.